Hi, it's Dr. David Greene, founder and CEO of R3 Stem Cell, the global leader in regenerative therapies. All right, today I'm starting the FAQ series with question number 1, which is what type of stem cells are used for clinical treatments? Okay, so there are different types of stem cells that are available throughout the world. Some of them are appropriate and safe to use for clinical treatments, others are not. So let's start with the ones that are not safe for clinical treatments. We get asked about these every week. The first is what's called embryonic stem cells. Now, embryonic stem cells are the ones that come either from an aborted fetus or a leftover embryo from an in vitro fertilization procedure. Without getting into the ethical issues of embryonic stem cell sources, let's just talk about the safety, okay? So there are a few places around the world that advertise that you can get embryonic stem cell therapies, and it is a terrible idea for two reasons predominantly. The first is when you give an embryonic stem cell to an individual, they will immediately reject those cells. And it could be a fatal rejection. Why does somebody reject embryonic stem cells? It's because those cells still have MHC2 markers on them. Okay, and those are the ones that would spark up a rejection reaction as being foreign in the body. You can call them MHC2 markers, you can call them HLA2 markers, same thing, but that is the main problem. If you're going to actually give somebody an embryonic stem cell therapy, you should give them immunosuppressive medications, which kind of defeats the purpose, right? The second reason that embryonic stem cells are not safe to give is because they can produce tumors. Now, the tumor might be a benign tumor, something like a teratoma, but they can be very aggressive. There was a case report from 2016 of a person who went to several countries and received embryonic stem cell therapy. One of those was Russia, and he then had persistent benign tumors growing in his spine. Surgeons kept removing them, they kept growing back, and they were deemed to not be malignant, but if it's benign and it's aggressive, it can still compress your spinal cord and cause serious problems, right? So it's just not a good idea because of the rejection issue, because of the tumor issue. Embryonic stem cells are not safe to use clinically at all throughout the world. Now, there are something called iPSCs. Now, in theory, embryonic stem cells can be great because they have pluripotency. The pluripotent stem cells that are from an embryonic source are able to turn into any type of cell in the body. So in theory, that's amazing, right? But they're not safe to use. Now, if a clinic says that they are offering pluripotent stem cells, then one of two things is happening. The first is that they're using stem cells from an embryonic source, and that is not safe. Don't get treatment with a clinic offering embryonic stem cells. The second option for pluripotent stem cells is that they're actually not pluripotent stem cells. They're actually coming from an umbilical cord stem cell source, or there's a clinic in the Ukraine that is very close to pluripotency. They actually do use aborted fetuses, but they use them from a specific time frame during pregnancy where the MHC2 markers are gone. So they don't get rejected, and they say they don't have issues with tumor formation. So they're not quite pluripotent, right? But they're a little bit better, possibly, than regular mesenchymal stem cells, or what we call multipotent stem cells, all right? So true pluripotent stem cells are not available. If they are, they're not safe anywhere in the world. So there's a clinic in Mexico called Stem. They're offering pluripotent stem cells. One of those two things is happening. So then the question is, what do we actually use clinically? Well, there are multipotent stem cells. So you have pluripotent, which can turn into any type of cell in the body. Then you have multipotent stem cells, which can turn into a lot of different types, just not all. Those are the ones that can be safely used around the world. And there are two predominant types of multipotent stem cells. You may have heard of these: mesenchymal stem cells and hematopoietic stem cells. So as an example, umbilical cord blood has a decent amount of hematopoietic stem cells. Umbilical cord tissue, otherwise known as Wharton's jelly, has a plethora of mesenchymal stem cells. Now, if you switch to the autologous source, meaning it comes from your fat tissue or your bone marrow in the pelvis, the fat tissue has a predominance of mesenchymal stem cells, and that can only be used for yourself. The bone marrow source has a predominance of hematopoietic stem cells, and that can also only be used for yourself. Okay? So, multipotent stem cells are what can be safely used around the world, and the two main types are mesenchymal stem cells and hematopoietic. They are both multipotent, and we use them around the world. We've done 26,000 mesenchymal stem cell procedures over the last decade. We've never had a rejection reaction. We've never had a tumor formation as a result of the treatment. So it's been very safe from those two aspects compared to embryonic stem cell therapy. All right? Visit us online today at r3stemcell.com. R3 has over 70 centers in 7 countries. 7 countries. So call us to get your free consultation at +1 844 GET STEM, or email us at info@r3stemcell.com. Thank you.